Over the last few decades, there have been so many advances in cancer research that early screening and early diagnosis of cancer is more important than ever. And this is because if most cancers are diagnosed early, they have a really high survival rate. But unfortunately, the converse is true, is that if cancer is diagnosed too late, it can be fatal. And sadly, because of medical negligence with respect to the screening and the early diagnosis of cancer, many patients are left in a very dangerous situation with respect to their health because of the failure to diagnose the cancer early. Various scenarios and ways that this can happen are, for example, if one goes in for an x-ray of your lungs, if you're then later diagnosed, years sometimes later, with advanced non-small cell lung cancer, for example, whereas if it had been diagnosed earlier when the x-ray was first taken, the cancer's advanced and the patient's chances of survival have decreased significantly. Similarly with melanoma, for example, if a patient goes in for regular screenings with the dermatologist and the dermatologist fails to diagnose a melanoma, or with a breast cancer, for example, where there's a breast cancer screening and the potential lump isn't biopsied or the mass isn't biopsied and the opportunity is lost to address the breast cancer early. Those are all types of examples where the misdiagnosis of a cancer can be fatal to a patient. And so if you or a loved one have had this kind of scenario where there has been a failure to timely diagnose cancer, then you need to ask the question, use your common sense, could this have been the result of medical negligence? I'm Rich Newsome with the Newsome Law Firm, and if you or your loved ones have questions about a potential medical negligence case or the failure to diagnose cancer, give us a call. We'd like to try to help you answer those questions. Thanks for listening.